Hey, it's Dr. Toker. Someone asked me to record a little video on what we could do to stay healthy in the environment of this crazy viral outbreak. So I am a surgeon, so you don't normally think of surgeons as being people who are going to give you medical advice. Our medical advice almost always involves something sharp and pokey or cutty. However, part of our specialty as surgeons is to prepare patients for an anatomic insult in a way that they will heal quickly from that. So, in other words, nutrition is a huge part of what I do for a living because I operate on people in a way that if they don't heal properly, the consequences can be life-threatening. And so I do a lot of nutrition stuff. So it was the nutrition part of me that had me open this med spa. Now, the theme of our medical spa is Scandinavian. That's why it's the Scandi Med Spa. It's a Scandinavian theme. Why? Because in the Nordic countries, they have a tendency to do a couple of things unique to them that we don't do in America. One is they are much more likely as a population to use diet, exercise, herbal supplementation as not just a way of life, but also a means to prevent illness or to support a human being who's experiencing illness. Now, we do some of that here in America, but we always do it in a way that's like a money-making venture. And then it winds up losing its utility. The second thing that they do in these Scandinavian countries is they use a lot of like sauna. So they're living on an iceberg, and then they have these hot saunas. So I'm giving today's lecture inside a sauna because of an article someone sent me in regards to this virus. So there's something about extremities of temperature that help augment your body's immune response. So when these Vikings are walking through the ice and they're going into a sauna at 190 degrees and sweating it out, and then they're going back into the freezing cold, you would think that's a recipe for like disaster, but yet these people are living to be 120 years old. And as it turns out, there is something to that. So if you've got access to a sauna or something that's hot, and particularly they're saying hot, humid things, and then a cold shower, you may or may not be able to recreate some of that. I'm not saying that's medical advice. I'm just telling you, okay, if you wanted to make yourself feel better, you're not going to hurt yourself by taking a hot shower and then turning on the cold water. Like, you're not going to cause a medical ailment, I would not think, by doing that. I don't suggest you do what my husband does, which is in the dead of winter, he will jump in the pool. When it's like 30 degrees outside, he will cold submerge in the pool to be like a polar bear. And I'm convinced he is going to have a cardiac arrhythmia doing that. So I don't suggest that at all. He says it makes him feel better. I'm saying it looks dangerous. So I'm not suggesting that you do that. Okay. Anyway, so I truly actually am in here to do two things. Number one, demonstrate this is our green light. Now, if you saw our infrared video, I was wondering why the hell there's so much of this green light in different varieties of the green light. So I had to do a little research on that. I use the green light here for the estheticians because the green light is designed to offset redness. It's kind of in the middle of that color spectrum. And if you do makeup at all, you know that green will actually negate a red blemish. And then if you color that with some foundation, it's like your red blemish goes away. So it's kind of weird to put green dots on someone and then cover it with and then all of a sudden the person has perfect complexion. You can't see any weird red blemishes. So the green light does offset some redness, which is why we have it. There is some concept that the green may actually keep some bacteria from reproducing, and so people with acne sometimes like the green light. And then I was reading, there are some holistic people who will use LED light therapy for their patients who will use green light if the patient has the flu or viral ailments, especially in combination with the infrared sauna, because the infrared recreates a fever, which is thought to kind of discourage the virus from replicating. You know, I don't know that there is scientific double-blinded evidence on that. I am just telling you there are wellness professionals who use this sauna in that way. So you can take that as that stands. So I don't put the surgical medical doctor stamp on it, except that it is an approach of wellness. And there are studies. I just don't know if the FDA has quite made a statement on it. The FDA will not clear something that has not been double-blinded and shown to be reproducible in all people across a population, a therapeutic benefit. So even if it works for a lot of people, if the study's not done, FDA is never going to approve it. It's one of the reasons the FDA really has not made approving statements for many vitamin supplements, for many herbal supplements, for CBD. Because if you can't show the reproducibility across a population so that a dose equals a therapeutic response, then you're just not going to get FDA approval, even if you kind of know in your heart it's helpful. Chicken noodle soup when you have a cold. I mean, most of us feel like that's helpful. The FDA is never going to approve chicken noodle soup for that instance. But having said that, it's a salty solution that rehydrates people. It's warm. It's a low residue substance, easy to digest. So, I mean, honestly, there's some medical remedy to chicken noodle soup, believe it or not. The FDA was never going to say that. Okay. So what can you do? Here you are at home. You're socially isolating. That is the single most important thing for you to do to avoid from getting sick. Number 2, single most important thing to do is not touch a bunch of foreign objects when you're out and about. When you're shopping in a grocery store, do not touch all these surfaces and then touch your face or eat an apple on your way home, right? So it's the hand-to-mouth thing, the hand-to-face thing, that they're really correlating with the transmission of the illness, not just sneezing into someone's face. You got to be in pretty close proximity to get it directly from another person. But a sick person can be gone for 5 days and you still get the illness if you touch the same doorknob and then touch your face. You get it? Okay. So those are the things you can help from actually contracting the ailment. Is there something you can do to augment your, I am sweating like a, you don't want to know what I was about to say. It's a hot sauna. I am sweating like a pig. Anyway, what can you do to augment your immune response? Okay, if you have a fancy sauna, they say infrared heat will help augment your immune response. They say this green light will help augment your immune response. Vitamin supplements that can help your immune response. Vitamin C is important for your immune response. Zinc is important for your immune response. These substances are cofactors in many chemical reactions in your body, especially along the epithelial surfaces and in your immune cells. And so therefore, vitamin C, super duper important. Many people have a zinc deficiency, believe it or not. We don't seem to get enough zinc in our diet. So zinc can be helpful. I don't know if the FDA has actually approved zinc for a cold remedy, but if you have a zinc deficiency, you are more prone to getting an infection. We do know that correlation. Echinacea, that's real popular for colds. There's been a bunch of studies on that. Some of them say it's helpful and some of them say it's not helpful. Again, the FDA has not approved that. Having said that, one of the studies suggests people who are taking echinacea are more resistant to this viral illnesses, to viral respiratory illnesses. Take that for whatever it's worth. It's not FDA approved, but it's something that you could try to do to see if that helps you. All right. This particular viral illness, it's fascinating, seems to cause circulatory collapse and respiratory failure based on something called a cytokine storm. It's an inflammatory response that you will get from severe illness. Your body just goes haywire. Sometimes we'll give anti-inflammatories to that, like ibuprofen or steroids, but those two things have shown to worsen the outcome after this. And so based on that observation, people feel like there's a particular inflammatory molecule called IL-6, which is an interleukin. And IL-6 in high amounts absolutely will stimulate the cytokine storm phenomenon. And so many of the studies they're doing right now for treatments for this virus are mitigators to this IL-6. There is an herbal supplement that is thought to also help IL-6, and it's called Boswellia. I don't know how to spell that. I think it's Bowswellia. I was educated in Louisiana. My spelling is not my strong suit, but Boswellia. Look it up. Anyway, Boswellia is thought to dampen the IL-6 response, and so it's touted as an anti-inflammatory for that reason. This may be a good time to take Boswellia. The FDA, of course, has not approved this as any sort of treatment. But if you wanted to take it as an anti-inflammatory, it would not cause any harm. Okay? The second anti-inflammatory that I believe would not cause any harm is something called N-acetylcysteine. And that molecule, your body will translate into a molecule called glutathione. And glutathione is extremely important antioxidant. It's required for almost every chemical reaction in your body. And so most people, as we get older, are deficient in glutathione. And it may be this glutathione. Now, this is Dr. Toker talking as a research scientist, just making an observation. In this ailment, older people are succumbing. And ill people are succumbing. And those people, by definition, have less glutathione than the average person walking about. And it is definitely a possibility that a decrease in glutathione is leading to some of these poor outcomes. So N-acetylcysteine is an oral supplement that you can take that will help replenish the glutathione in your body. That's not going to protect you from any virus, but maybe if you got sick and you're taking all these anti-inflammatory things, you'll be less likely to get a severe infection. My lighting just changed. Anyway, what else? So zinc, vitamin C. Oh, vitamin D. Now, a lot of people are deficient in vitamin D, and it's because we use a lot of sunscreen and whatnot. So vitamin D deficiency is extremely common in our modern population. And vitamin D does serve an important role in your body. And so I think a vitamin D supplement is probably in order for most of us as well. And again, I think the point here is to overcome vitamin deficiencies so that if you were to get sick, you have a more normal response to the ailment instead of this crazy, unbalanced, wackadoodle response that some people are getting, right? So the whole concept in life is balance. And so if you don't have any deficiencies, your body is more likely to have a balanced response to something. So I guess my best advice for people who are at home and want to make sure if they got sick that they wouldn't get like the sick that kills them, balance, right? So that gets us back to eating healthy and drinking lots of water. So this is Dr. Toker, now the diet doctor, talking. Take your weight, divide it by 2. That's the number of grams per protein per day that you need. Do not consume more than 30 grams of protein in any given setting, because you cannot absorb more than 30 grams of protein in a given setting. So I weigh 145 pounds, so I'm going to divide that by 2, so 72 grams of protein. I'm going to divide that number by 3, let's say, and so I will have 3 meals of 25 grams of protein to make sure that I'm meeting my daily requirement of protein. Protein is only good when you have the proper vitamin cofactors. that help your body put those proteins in the right place at the right time, which means you got to eat lots of unprocessed foods and whole organic foods, fruits, vegetables, whole grains, organic, unprocessed, chicken, beef, eggs, fish, from a vegetarian standpoint, unprocessed legumes are high in protein and whatnot. So you want to make sure you eat as clean a diet as humanly possible so that all the vitamin cofactors are present in your food. Taking a pill supplement is not the same as eating the whole food supplement. It's one of the reasons why we sell standard process whole food supplements. And standard process has all of the vitamin supplements I just talked about, except they don't call them zinc. Their zinc supplement is not called zinc. It's called Chezyme. Okay, their vitamin C supplements, they have a bunch of them. We'll include a letter C in all of those. They do have a Boswellia supplement, although it's on back order for obvious reasons in light of this viral thing. There's nothing is going to beat eating raw fruits and vegetables in an unprocessed form. Get twice as many veggies as fruits. Drink 64 ounces of water a day. Try to get some form of exercise. Try to get into the sunlight because of the vitamin D thing. Okay? What else? That's about it. Okay, so stay healthy, drink, eat well. Don't touch any contaminated surfaces and then fail to wash your hands and then touch your face. That's bad. And then if you were going to go to the store and get supplements, vitamin C, zinc, vitamin D, N-acetylcysteine, herbal supplements, echinacea, boswellia. There's one called ashwagandha. And ashwagandha is designed to stabilize your adrenal glands. And we're all under a lot of stress. So relaxing and not having a stress response is critical to not getting this cytokine storm if you were to get sick. Be as relaxed as you can. Try to mitigate your stress as much as you can. Meditate, yoga, hot showers, eat healthy. Use this opportunity as a gift from God, even though I know it doesn't seem that way when there's death around you and poverty staring you in the face. But I think in the long term, we're going to learn something about ourselves, we're going to learn something about our society, and we're certainly going to learn a lot about science in this war against this virus. So it's fascinating times. Keep a diary. Anyway. All right, so that's my advice for the day, for whatever it's worth. See you soon.